The following program was made possible by a generous grant from the Josiah Macy Jr. Foundation and by the Health Resources and Services Administration. At the University of New England, students in a variety of health professions programs are learning with, from, and about other health professionals. The foundation for interprofessional education and practice that's established during students' on-campus years, in classrooms and simulation labs, prepares them for their roles as practitioners and future leaders in healthcare transformation.
We've had so much time where we've had a physician practicing in their office, a pharmacist practicing in their pharmacy, and a lot of disconnect. And what we found is that leads to errors. It leads to poor patient experience, poor patient outcomes, because we're not communicating as well as we could be or should be.
Care that's provided in these silos, it only gets the patient so far. When professions are brought together and they work together in a way that is collaborative, then there's so much more that is going to be impactful.
What sets UNE's approach to clinical interprofessional education, or IPE, apart is its unique curriculum. Developed by the university, UNE's Clinical Interprofessional Curriculum, or CIPC, is a menu of 10 interprofessional learning activities for health profession students in clinical settings. They're based on national IPE competencies, patient-centered medical home standards, and team STEP skills. Not only do these learning activities teach students critical skills, but they also add value to the clinical setting, providing an opportunity to take a closer look at a patient case or public health issue.
We know from research that a team-based, interdisciplinary-based model of education improves outcomes, improves patient satisfaction, and decreases medical errors. So it's really the way to go. And we're proud to be one of the leaders in the nation in training our students in this interdisciplinary, team-based model of care.
Through collaborations between UNE and two key clinical partners in Bangor, Maine, Eastern Maine Medical Center, and Penobscot Community Healthcare, students are gaining clinical interprofessional experience, working with fellow students and providers from a variety of disciplines to provide effective patient care and improve patient outcomes and experiences.
And the pharmacist was able to work with me with my monitoring my blood sugars, how much insulin I should be taking, when I should be taking it. And it was a nice addition to just seeing Dr. Mamula, who is wonderful. But it brought a whole nother expertise in. And I think with that, it's really helped a lot. And now we've tag-teamed me onto the nurse, case manager, who's going to help with other things. So between all of us, we're going to get it covered and get my blood sugar down and keep all of my fingers and toes.
And I don't think I realized what a gift it was until I started teaching and realizing that, I can show my students that we can take a patient with benign positional vertigo and walk her down to the physical therapist and make her better within one visit.
At Penobscot Community Healthcare, this includes weekly structured student learning activities built upon the UNE Clinical Interprofessional Curriculum. Students participate in team-based exercises that address emerging issues in healthcare and population health, which foster a greater understanding of each profession's role in the care and health of patients, as well as what it means to be an active member of an integrated healthcare team.
I see patients now not just within the four walls of an office visit. I see all these socioeconomic factors play into them, like are they able to have a ride to the appointment? Are they able to afford their medications?
Students at both Penobscot Community Healthcare and Eastern Maine Medical Center take these lessons not only into clinical settings, but into patients' homes.
Hi, Linda.
Hi.
How are you today?
Good, how are you?
Good.
They've established unique interprofessional home visit programs that provide high-risk complex patients with low-barrier access to care,
First, do you have any medication questions or concerns?
while exposing students to the reality of their patients' lives that can significantly impact their health.
A group of students will go to a patient's house and see a physical environment that immediately tells them that the health plan that was designed for them on discharge is not going to work. That it's just not realistic to do that in this environment. And then they can reformulate and rethink and reprioritize and create something together with the patient's involvement that does work.
Medical educators say the learning comes together for students during debriefing sessions, whether it's in the car immediately following a home visit, through reflective writing exercises, or back in the clinical setting. By emphasizing teamwork, team functioning, and how each student demonstrated importance and value to each other and the patient, students develop the ability to intentionally apply these principles as they enter into healthcare teams throughout their training and careers.
Everyone has their different expertise, and if you sit back and say, well, this is what I'm thinking, and then you listen to what everyone else says, you'll see the similarities and differences, and then you'll be able to help your practice based off of that.
It will improve their ability to collaborate with these areas of expertise even outside their system. They'll have a better understanding of the training of these folks, of the work that they can do. They're more likely to take advantage of those resources in their community.
I'm very interested in practicing rural medicine in Maine, and I'm from Maine, and I know that there's a great need for doctors in Maine, especially in underserved areas. And so I really want to carry forth my desire to be in an interprofessional practice in rural Maine. The future of healthcare is moving towards a more team-based approach, and I think that the more students can have experience with that, the better off the whole team will be.
None of that can be accomplished as one profession on our own. It really comes from the benefits of working together. And so interdisciplinary education is really critical for us to be able to build the teams of the future.
The skills, competence, and confidence UNE health profession students develop during their interprofessional training are applicable to clinical practice in any setting and strengthen the collaborative relationships that form among colleagues, patients, and families. For more information on how to incorporate interprofessional education into your practice, you can access UNE's Clinical Interprofessional Curriculum online.